most parents who are coming to us for treatment, they're pretty aware that their kid has a problem with drugs. So typically, to come to our level of care, they have had, often some troubles in school where they've been expelled or suspended because of drug use. They're having run-ins with, police, things like that. School grades will start to slip. Friends will start to become less important. Activities that involve high level of commitment, like sports, tend to go away. And the more I'm using, the less I have time for those things. I will say with friends are often the access to drugs, or can be, at least if they're using as well, supportive of that behavior. So it really is, you'll see a sharp kind of pairing of who I want to spend my time with. So if they have, 10 friends and, five of those friends are good friends and five of those friends are questionable friends, you will see those friends who you have a better relationship with, who you are trusting are doing well, all of a sudden become less important and less, involved in that kid's life. Substance use tends to start because I feel something and I don't want to feel it, right? I want to feel something else. And drugs are amazingly effective at changing how I feel. And so the underlying conditions of what cause me to feel things that don't want to be felt. So depression's a major one, or anxiety would be very, big as well. But with that, we get a lot of kids who've had some real traumatic events in their life. And so with anxiety or PTSD, post-traumatic stress disorder, again, these are life experiences that I'm having that impact my nervous system, that I don't feel good, and drugs can change those things. We are seeing now even a rise in like our level 1 autistic kids who are using a lot of substances, and so they have sensory issues that they're looking to change through substance use. I think that there can be a little bit of misnomer around the co-occurring disorder, and often professionals think that if I just work on the underlying issue of anxiety and depression and PTSD and these different mental health issues that are happening, my kid's drug use will just kind of go away. And while that is possible that could happen, the research suggests that once we've entered treatment with a diagnosable substance use disorder, it's honestly become its own problem. And while the foundation of it may be built on these other mental health issues, it takes specific substance abuse recovery interventions in order to have the most effect on whether they will continue to use post-treatment. And so when a kid comes here and they're feeling depressed and we get them on the right meds and they are feeling better and they have forced abstinence, should we not address the skills of recovery? Should we not create a relapse prevention plan? Should we not walk through the issues of long-term sobriety, what those could be and how you stay on a healthier path? Get home, they feel good, and then a hard life event happens and they say, what worked? And it was the drugs to fix that hard life event, right? It fixed the way that I felt. And so again, it can be a little bit of overly optimistic thinking that if we were just to work on the mental health when my kid has a diagnosed substance use issue, that's just kind of going to go away on its own. That's not really supported by research. It is supported that they should be done together. And even other factors like ADHD and ADD, that those being properly medicated and treating have profound positive impacts on substance use. And so really it needs to be done in more like a holistic kind of approach to the kid. We don't put anybody into a specific addict category. We really try and meet the kid with where they're at in their substance use and help them understand where they are in that story, and really take, in a lot of ways, a prevention approach. As while some of the kids have had some life consequence as a result of their drug use, most often by virtue of age, by virtue of just being a teen, they have normalized this and they think it's okay, and they're not often willing or coming to us with willingness towards change. And so really helping them understand what the trajectory they're on should they continue this behavior. And so we don't have to label somebody an addict to be able to help them understand hey, like this is the choices you're making. This is the impact it's had on you, your family, and the trajectory of your life. What do you think is going to continue to happen should you remain on this trajectory? And so a lot of it is much more meeting them where they're at and motivation towards change driven versus your typical kind of thoughts on recovery, which is just kind of people already kind of accepting that they have some sort of problem and are just then trying to figure out what are the things to do about that. Our goal is when somebody comes in with a significant substance use co-occurring disorder, that we are going to figure out where are they starting with that as far as their motivation, as far as their insight, as far as their willingness towards change. And we want to be able to move the needle in a path that is towards sobriety. We're helping them see that there are things that have to change, and what of those things do you feel ready to make a change in right now, hoping that the positive benefit of that experience will create further motivation to continue in a journey of recovery. Here at Independence, we do take more of an abstinence approach. So we are a residential treatment center. And so if you're here 60 to 90 days, you will be drug-free for 60 to 90 days. And so because we're residential, it kind of allows that opportunity for what we call forced sobriety, but just the benefit of feeling physically healthier away from drugs through rebalancing kind of your lifestyle, having, a lot of our program is set up to help you have a positive and healthy daily experience, not just through the therapeutic modalities, but through physical activity and different groups that are designed to get you moving in a healthy way, and also with appropriate medication management. And over the course of the 60, 90 days, hopefully you are physically feeling better. And some of the reasons that you thought that you needed drugs to change how you felt, start to maybe not be as important. And so considering to stay sober beyond the walls of treatment becomes more of a realistic and attainable goal for these kids. The basics of relapse prevention is we do need to learn some stress mitigation, and there's just different coping strategies and grounding techniques that we are going to work on that would be unique to the person. It'll help you find what works for you. There are two different types of things we're trying to do. One is how do we reduce our overall daily stress so that we are not allowing to get built up and worked up with these negative emotions in a way where we feel like only drugs can change them, right? And so those are things like journaling, daily fitness goals, things that are just designed to overall mitigate stress. Then we take the kind of more of acute, you're having a stressful moment, what do we do about that? So there are like thought stopping techniques, breathing techniques, different skills of stress management that we're going to teach. And the whole process of being in our program is we were going to build what we call a relapse prevention plan that is unique to every kid. That's going to be what are the things that work for you in order to kind of help you stay grounded on a daily basis and help you stay committed to your sobriety goals on a daily basis. And then what are the specific skills that work for you when you start to struggle, right? And so we're all a little bit different. We all have a little bit different needs around those things. And it's helping that kid in the course of their time here figure out what works for them and then committing to a plan of how those things can also be achieved in the home environment. Personal boundaries and structure are often the keys to sober living. And a teenager still needs boundary and structure from their family. And so coming to a program like Embark, you are going to get parent coaching and you're going to do family therapy on how to be a healthy and safe boundary and supportive structure for that teen. A lot of our families come to us feeling like they are in chaos with their kid. And they have no ability to provide those boundaries or be that structure. And so here, you get the opportunity to have a little bit of a reprieve from that chaos while your kid is in treatment. But it's not just meant to be an emotional reprieve, it's meant to be a time to work. What are the things in my home, the structures and the boundaries and how we operate as a family that may need to change to support my kids' sobriety journey, or at least what it looks like to be a safe and healthy home. My motivation to stay sober shouldn't just be, or it's not often going to be able to be successful when it is just about not doing something, right? It's that I have meaning, purpose, and value in my life moving forward. And so one of the first markers we try to see is, can this kid identify motivation that's both internal and external? And that we know motivation changes over time. So having the skill set to develop motivation is really critical. From the ability to have motivation, do we then see honesty? Addiction and drug use is often bred in secrecy and withholding the truth, withholding the realities of what's happening in my life. And so, as we find motivation for recovery, are we more honest with what we have been experiencing and why we have been experiencing it, and are able to get more help that is authentic to the needs that I actually have because I'm honest with those needs? And from there, can I receive support? Can I recognize that I need support from others, including accountability, in order to be successful in breaking old habits and forming new habits? Will I have willingness to participate in new activities and new healthy things that I didn't want to do before? It's like I'm dealing with lots of stress and anger and these issues. Can I go to the gym and participate in doing some weightlifting and kind of work some of those out in just a healthier life habit kind of way? And then as I do those things, I'm more community based, I'm more relational based, I'm more open, I have motivation. Can I work intentionally? And here we do have certified alcohol and drug counselors. Can I work with them intentionally on a relapse prevention plan that would translate to what my home life looks like? Can I not just be transparent with my drug and alcohol counselor, but can I be transparent with my parents, my family, about what's really going on in my life? Can I take these skills home? And then finally, this one's going to sound tough. Nobody wants to hear this one, but can I build a bounce back plan? Because so often we think if somebody has a relapse, they haven't learned anything. And it's like, no, you've learned so much in your time sober. And really, if we have a relapse when we go home or make a mistake, do we have a plan of action that actually helps us bounce back? That shows us, hey, we didn't lose the last 200 days sober because we had a relapse, we made a mistake. We've learned something in those 200 days. And now how can we put this together for 400 days, right? Can we bounce back from a mistake that's been made, and recognizing a lot of thinking and addiction is all or nothing. And that's how we often make the choice to go back to the addictive behaviors. I've messed up in something, therefore my world's messed up. I'm going to go back to my drug use because it's all just messed up anyway, right? But that's not often how life is. Life is not often all or nothing. And so if somebody makes a mistake, can we have a plan that helps them bounce back? And it's not that we hope that somebody has a relapse in their recovery, but we're going to be realistic and recognize that it could happen. And even in that, we should be prepared for how would we bounce back from this and continue on in our journey of sobriety.